I'm Dr. Angela VanGilder. I'm the general surgeon here at Floyd County Medical Center, and we're going to be answering 10 questions about general surgery today. A general surgeon is a surgeon that is trained to treat a wide variety of surgical issues. Normally we concentrate on intra-abdominal surgeries that do a lot of hernia repairs, gallbladders, appendix, colon surgeries, but we're also trained to do skin cancer excisions, breast surgery, vein procedures, kind of a wide variety. My favorite procedure is probably an umbilical hernia repair because that's sort of a quick fix and it's very satisfying. But I also like to do colon resections because of the technical difficulties with those. It requires a little bit more skill. So we do use dissolvable and permanent sutures, kind of depends on the wound. A lot of times we do skin closures with dissolvable sutures, but sometimes they don't quite dissolve all the way. Usually that's just a knot or something that didn't get dissolved. So if that happens, then come into the clinic and we can remove that suture for you. I wouldn't recommend trying to remove sutures yourself. Absolutely, we have music on throughout the whole case. I like to listen to the Killers, the Bleachers. Sometimes we listen to some 80s hair bands. Sometimes it's hip hop. Kind of just depends on the day, on the case. Yeah, so that is necessary to clean the colon out so that when I go in there with the colonoscope, we can actually see the lining of the colon clearly. If stool's in the way, I can't see anything, and we need to be able to see that so we can identify polyps and remove those. And removing those polyps prevents colon cancer. So when we do abdominal surgery, there is a risk of that not healing and get kind of pulled apart and forming a hernia. And so to prevent a hernia, we usually give you a weight restriction, maybe less than 10 pounds of lifting for about 6 weeks after surgery. So that can happen after laparoscopic surgery. So when we do that surgery, we inflate the abdomen with CO2, and that just gives us some space to work. At the end of the case, I try to suction all of that air out of the abdomen, but if it stays in, it can kind of irritate the diaphragm, and that gets referred to as shoulder pain. That usually goes away within 24 hours, but it can be a little bit uncomfortable for some people. So you can't drive after getting anesthetic. That is kind of like going to the bar and having a few drinks. It does impair your judgment. It decreases reaction time. It's just not safe to do. So that's why you need a driver to take you home the day of surgery. If you're taking pain medications after surgery, you also can't drive while doing that. And that's the same sort of thing as drinking and driving. So laparoscopic surgery is small incisions and using a camera. It's usually the way we do most of our abdominal surgeries, minimally invasive. The advantage is that these small incisions have less postoperative pain, and it also has a faster recovery time for patients. I like general surgery because a lot of times the patients I see have life-threatening condition or an ailment that's making them very sick and interfering with their daily lives. I can go in there and fix it and get them back to doing their normal stuff pretty quickly.